To some other news stories now, the Competition Commission has gazetted the terms of reference for the market inquiry into private healthcare. The inquiry is set to start on the 6th of January next year. Martin Versfeld, who's from Weber Wenzel, joins us now for more. Martin, taking a look at these terms of condition starting in Jan, and I understand that they're going to take a year to complete this inquiry.
Well, no, they're going to take 2 years. They've set it for November 2015 is when they have undertaken to file the report. In my view, I'd be very surprised if in fact they managed to achieve the conclusion of that investigation by November 2015. I would have thought it would take at least another year.
How come?
Well, the scope of the inquiry is very significant. They're considering, and I think this is appropriate, they're considering every single element of or segment of the medical industry in order to try and identify the cost drivers. And in order to do that and to get a sense of the scope, you're talking about the medical healthcare funders, you're talking about the hospital groups, you're talking about the specialists, you're talking about the pharmaceutical manufacturers, the manufacturers of pharmaceutical devices. So if you're going to engage in detail around the way in which each of those segments of the market do business and what the cost drivers are in relation to each of those, that's a very significant undertaking.
Just on that has far-reaching implications, they're not so?
It has potentially significant implications. I'm not sure whether they have competition law implications, which is a question in of itself as to why is it that the Commission has been seized with this investigation. But true, it involves an interrogation of the entire industry, and our view is probably that it's government's way of interrogating the industry with a view to trying to make the national health insurance process a viable process.
Are there any other sectors that might be implicated by this?
The sectors that are it's just the health sector, and within the health sector, I suppose the focus is obviously the private health sector. Although importantly, the frame of reference does or the terms of reference rather, recognize that the state, the interaction between the state and the private sector is also a significant consideration. And that's certainly a distinction from the original terms of reference, and an important one. Because the state itself drives costs. When the state decides to increase the salaries of nurses, by way of example, in its hospitals, that changes the dynamics in terms of demand and supply, and it has an impact on the private sector, who in turn have to increase the salaries of their nurses. So that interaction, I think, is also significant.
What does that tell us about the relationship then between the state as well as private healthcare facilities?
Well, I think few people realize, firstly, that the state has private wards within its hospitals. A few people realize that the way in which the state procures drugs on a tender basis, but that the tender prices have an impact on the level at which pharmaceutical manufacturers can in turn supply the private sector. Effectively, there's a significant level of cross-subsidization. So there is an interaction, and the way the government, I see it, is that the government's obviously trying to ensure that the private space is more affordable, and in so doing, reduce dependency on the state sector.
So depending on the outcomes, it could be a positive for all.
Well, the idea is obviously to drive down costs for the benefit of consumers. That said, providers need to ensure a reasonable rate of return, otherwise they won't be interested in participating in this sector. And it's an open question whether in fact the finding is going to be one which suggests that healthcare inflation is inordinately high. It should be borne in mind that the healthcare industry is very labor intensive. So it takes just as many nurses today to service a patient as it did 100 years ago. A patient still occupies the same size bed as they did 100 years ago. And so unlike a lot of industries, this is very labor intensive. And when you look at the inflation indicators and the products that go into that basket, those products have benefited in large measure from the efficiencies that are derived from developing and innovation. The health sector, though, has a significant labor component. They can't escape that. The orchestra that would have played for Mozart centuries ago has to be the self-same size today with the self-same number of players, and will cost more or less the same in real terms if you allow for inflation. And this is why you see a disconnect between healthcare inflation and normal inflation. The normal healthcare inflation basket simply doesn't adequately measure the inflationary pressures associated with providing a health service.
You mentioned the inquiry will focus quite a bit on cost. What about the quality of healthcare?
I'm not sure that the medical, well, although they're experts on the panel, I don't think they're going to be looking at quality. That said, ironically, from a competition perspective, I would say that the principal competition is in fact around the quality of services provided and not so much around the price at which those services are provided. When you and I go to a doctor, are we able really to assess the quality of that doctor in an objective, arm's length fashion? I don't think so.
Maybe if I get better, huh? You finish your antibiotics and you get better potentially.
But you're not, and when you negotiate, you don't negotiate with the doctor and say, listen, will you see me for 250 Rand because the doctor down the road will see me for 350 or 150. You go there hoping for the best care. You're price insensitive up to a point because, in fact, your medical scheme, if you're a privately insured person, is going to pay. And so the question is not about how much you're paying. The question is, do you feel that the doctor is adequately skilled and giving you the right service, and does that doctor, he or she, make you feel comfortable?
So we'll definitely be looking at the results of this inquiry with bated breath.
Indeed.
Thank you so much, Martin.
Thank you very much.
Martin Versfeld, who's from Weber Wenzel.